You ever heard that old saying, you can't change people or it's very difficult to change? Well, Professor Victor Strecher of the University of Michigan says you can change people, and he's found out a way to do it. Thank you so much for joining us,
Oh, so
Professor.
happy to be here. Yeah,
now,
it's fun.
This is what you've based your entire career on, really, as a professor of behavioral science at the University of Michigan. What are some of the key components to getting people to change?
Well, one of the things that you need to know is what the lifestyle is of that person. Let's say you want to help a person lose weight or manage their weight, just keep the weight where it is. You would want to find out whether they're doing the shopping, or whether they have a spouse who shops, or whether they eat out, whether they cook the food, whether they have other people in the family who are overweight, what kinds of food preferences they have. If I want to quit smoking, I might want to find out, are you worried about gaining weight if you quit smoking, or to try to quit smoking? Would you have a lot of stress? Have you had other experience trying to quit? Do you have a spouse who smokes? No matter what health behaviors you have that are, by the way, these health-related behaviors can really influence your health down the road. I mean, over half of disease and death is related to our behaviors and is preventable.
Right.
So we really need to work on these things. We know that if we ask the right questions about the barriers that you have, your self-confidence that you have in different areas, what your motives are, why do you really want to do this? Do you want to set a good example for your children? Do you want to save money? Do you want to look better? If we could capitalize on those things and build a plan just for you, which is what a therapist does, we know that we can create much higher rates of behavior change if we do this in a disciplined way over what you might just get through a common sense approach or trying to do it on your own.
Okay, well, compare for me what those two approaches are and how to look at a situation in those two different ways.
Okay, I'll give you an example of a smoker. Let's say a smoker would like to quit. They're a single mom, they have 2 kids, they're really worried about gaining weight, and they have a lot of stress in their lives anyway, and they smoke to control stress. But they really want to quit smoking because they want to set a good example for their kids. Well, if I were a therapist or a health coach helping you, I would certainly put together just the right information for them, removing all the irrelevant information, and tailor a plan for that individual and help them over time change their behavior, following up at just the right time. We can now do that with software. So we can do this with the internet, we can do it with mobile phones, we can do this by collecting information just as a good therapist or health coach would, and then feed back a plan for you to change that's completely tailored to you. So there are trillions of different variations, literally trillions, compared to what, and so nobody ends up getting the same guide or program or plan. And we found that as we tailor more deeply, we get much higher rates of change, successful quitting.
Well, companies are certainly interested in how do they change the behaviors of their employees, right?
So that companies are so important. Companies feel that this is so relevant because we know that people who are overweight or who smoke or who have a lot of stress in their lives also are less productive. And so a company is going, wow, I could improve productivity, I could reduce absenteeism by helping people manage these different behaviors. Great, I'll do that. And if I could do it in a way that's less expensive, what we call digital health coaching, so we can become a health coach for you, but online or on mobile technology, 24/7, helping you at any time, that's something that employees really enjoy and appreciate taking. So it's nice when they actually like it when their employer offers these kinds of services.
Sure. And for the employer, though, who is already pretty caught up in doing what their business is, do they have the patience and the dollars to really invest in the time, it sounds like it takes, to really change someone's behavior?
Increasingly, companies are coming up with the dollars and cents. It used to be that this whole area of, quote, wellness was relegated to the holiday fund, at the end of the year. Well, let's just do some nice things for people. Now it's not. It's taken very seriously. People are getting health risk assessments who are employees, and then based on those health risk assessments, they're being offered different ways of changing health-related behaviors that really saves the company significant money. Just for example, Johnson & Johnson, the company who acquired 2 years ago Health Media, the company that I founded, Johnson & Johnson over the last decade has estimated that their wellness programs have saved them $250 million.
Wow.
That's serious.
A lot of money.
So they've really helped their own employees. Their employees are benefited. So this is a win-win.
Okay. And Professor, one last word really. How long does it take? How much time should companies be committing to changing the behavior of one employee?
Well, we know, for example, that a smoker can cost an employer $1,500 more a year. An overweight person can cost $1,500 to $2,000 more a year.
Okay.
That's serious. So, and in terms of productivity, sometimes it's a whole week long amount of productivity loss if you have a lot of stress in your life.
Okay.
So let's help develop programs to help people manage their stress better, to quit smoking, to lose weight, to work out.
And the time commitment it would take to get someone to stop smoking?
Well, the nice part about online programs or mobile programs is that people can do these at home.
Okay.
They can do them during break times, they can do them during lunch times, and they can do them online. So whenever is most convenient, they can return to a program, and they can keep working on their own behavior change. They can talk to other people if they want. These are programs that are really 24/7, so it doesn't necessarily take, and they don't necessarily take a lot of time. In fact, I think sometimes the more time you spend on some of these areas, the less you succeed. You really want the right help at the right time rather than a lot of help at the wrong time.
Right, right. All right. Great stuff. Thank you so much for your time today.
That's nice.
I'm Mabel Jung at the World Healthcare Congress in Washington, D.C.